Hello everyone, my name is Kim Fu. I'm a Doctor of Occupational Therapy student, and today I will be presenting on my doctoral experiential on exploring occupational therapy for daily harm reduction for substance users in Western Massachusetts. This doctoral experiential explored and described how OT can be utilized in daily harm reduction for substance users. This doctoral experiential also focused on advocacy and educational efforts to better inform the general public and major stakeholders about occupational therapy's scope of practice and how it could be further utilized in substance use care and treatment. Substance users can be anywhere in the stages of change. Every substance user is unique in their history. However, the majority may share common effects based on their substance of choice. However, the effects that substance use has on ADLs, IADLs, mental, sensory, and bodily functioning often go unaddressed and unnoticed. These functional and physiological impairments can complicate one's health, prevent them from seeking recovery, and can continue well into initial abstinence, which can threaten recovery if left unaddressed. It's essential to understand that one of the biggest obstacles preventing substance users from seeking recovery is the fear of physical withdrawal symptoms that can often be exacerbated from these functional and health impairments. It's important to recognize that only 2.9% of occupational therapists work in mental health, with even a smaller percentage working exclusively in substance use care and treatment. The occupational therapists that do work in substance use care are often working with individuals who have undergone initial abstinence and are in the process of reestablishing their new life. Occupational therapists traditionally help substance users reframe distorted thoughts that are associated with substance use, develop new roles, habits, and routines unrelated to substance use, learn sensory-related substance triggers, and new coping skills. However, OT has not been utilized in harm reduction. Harm reduction is a strategy that aims to minimize the adverse effects of substance use, primarily focusing on preventing overdoses, overdose-related deaths, and the spread of infectious diseases such as hepatitis C or HIV. However, there are limited harm reduction strategies that target substance-related impairments that occur on a day-to-day basis. My time at my community site, Hampshire Hope, gave me the opportunity to realize that occupational therapy can be used to mediate the substance-related impairments in daily life. Hampshire Hope is a multi-sector community coalition that is based out of the Northampton Health Department. Hampshire Hope is focused on addressing the opioid epidemic through policy reform, community education, and collaborative programming throughout Western Mass. Hampshire Hope has been nationally recognized for their drug addiction and recovery team, otherwise known as DART. DART is a regional interprofessional program that provides immediate support and resources to those who have experienced an overdose and to their loved ones who have experienced secondary trauma. DART also provides education, training, and technical assistance to all DART partners. Partners include recovery coaches, first responders, law enforcement, the district attorney's office, harm reduction specialists, and various healthcare providers. During my doctoral experiential, I had many opportunities to engage with the DART partners, especially the recovery coaches. I realized that the recovery coaches served as peer support and had a prior history in substance use themselves, mostly in alcohol use disorder. While the major concepts of addiction can be transferable amongst substances, the recovery coaches did not have much experience or extensive background knowledge in other substances, especially in regards to the physiological and daily impairments. I witnessed the lead recovery coach and major stakeholders emphasize the importance and need for providing holistic care. I saw this as a unique opportunity for my doctoral experiential and was determined to help them meet this need. This led me to create the Manual on Daily Harm Reduction. I created a resource that focused on common illicit substances and described each substance's impact on health, well-being, their impact on ADLs, IADLs, mental, sensory, and bodily functioning. I also utilized my creative clinical problem-solving skills and provided feasible strategies that can be implemented into ADLs to reduce functional deficits. It's important to recognize that if we do not address the physiological and functional impairments substance users experience, they can continue on this negative feedback loop, in which individuals use a substance, they experience a negative or physiological effect, which impacts their ability to complete ADLs, and which reduces their overall functioning, then reduces their sense of well-being. This puts individuals at high risk for self-medicating behavior, such as using more substances, which can further exacerbate this cycle. This negative cycle will further deviate substance users away from health, functioning, and well-being. And this is where daily harm reduction can play a major role. Daily harm reduction follows the same concept of traditional harm reduction, except the strategies are implemented into ADLs and IADLs to minimize the daily adverse health and physiological effects associated with substance use. In doing so, this can prevent further functional and health complications. It can prevent overdoses and help reduce substance-related deaths. It can also prevent individuals from using more or other substances to self-medicate. The overall goal of daily harm reduction is to increase substance users' quality of life by helping users have the best level of health and functioning possible while taking into consideration their substance use. This can help establish a foundation of health and wellness for individuals who may consider pursuing recovery in the future. Daily harm reduction can also help mediate physical withdrawal symptoms to help facilitate and promote long-term recovery. Here is an example from my manual on daily harm reduction on how opioids can affect toileting. One instance is opioid-induced constipation. Opioids cause the bowels to overabsorb liquid, resulting in hardened stools. Some opioid users may go 3 to 5 days without a bowel movement. They run the risk of having impacted bowels, which needs to be treated by medical professionals. They are also at risk for hemorrhoids and anal tears when they are pushing, and these can become infected. Opioid users can try the following daily harm reduction strategies to relieve their constipation. They could try Miralax or stool softener to increase the stool's water absorption. They can try to increase fiber consumption using various foods. Users can also try to change the position in which they're sitting when they're having a bowel movement. As you can see in the image, sitting in an upright position puts a kink in the rectum. This places a lot of strain on the rectum and anus. That, along with the hardened stool, can increase one's risk of hemorrhoids and anal tears. By propping the legs up or bending forward to a 35 or 45 degree angle, this can reposition the rectum, allowing for easier bowel movements and less strain on the rectum and anus, which can facilitate toileting for opioid users and prevent hemorrhoids and anal tears. Besides the creation of the Manual of Daily Harm Reduction, my doctoral experiential also included co-writing a newspaper column for the Gazette Daily, educating the general public about occupational therapy. I also co-wrote a chapter on wellness for the Workplace Toolkit. The Workplace Toolkit is a resource and development for employers and employees who are looking to have a recovery-friendly workplace. I also created another resource for chronic discomfort management that utilizes stretches. I also presented on today's topic and OT scope of practice to Hampshire Hope affiliates and the general public. This experiential gave me the opportunity to push the scope of occupational therapy, and especially in a field that is a public health crisis. I've learned so much. I hope you've learned something new today too. Thank you for coming to my presentation today.